Good evening, good day, afternoon, whatever it is where you are when you're looking at this. My project today is called Cuba County, A Cry for Help by Jamie Cleveland. I just want to point out real quick, this health promotion intervention has got to do with the drug use and drug abuse and drug overdoses that have happened in the recent time, uh, in the near recent, in my community. So that's what this is about. Um, that's why I chose this picture with this specific picture with the hypodermic needle, as it is indicative of what's going on in my community. Again, this is the picture. In these charts right here, it shows in Cuba County the overdoses that we've had um, involving all drugs versus the overdose deaths that we've had in our community uh, due to heroin. As you can see, the most um, shocking part and what I wanted to point out is the sharp increase from 2013 up to 2015 due to overdose deaths involving heroin. In 2015, 348 Cuba County residents were admitted to the State Office of Alcoholism and Substance Abuse Services, um, or a certified treatment program in that division. According to the data, the latest Cuba Opioid Quarterly Report published this fall, and this is in 2017, by the State Department of Health, that number increased to 361. So basically, what this is showing is that it's showing us that more people are reaching out for help, and there's more people that are concerned with what's going on and trying to get the help. And so far, at the point of this report, and in 2017, there had been 104 already. In 2016, a report on the news website auburnpub.com stated that 16 Cuba County residents died as a result of an opioid overdose, which is a rate of 20.4 for every 100,000 people. The rest of the state of New York, excluding the city of New York, has an overdose death rate of 16.7 per 100,000. The local number is a slight decrease um, from the 2015 numbers when 17 people had died from opioid overdose, and that was a rate of 21.7 for every 100,000. Um, there have been at least 20 people who have been treated in emergency rooms and hospitals for opioid overdose in the first quarter of 2017. Through July of 2017, naloxone, the overdose reversal drug, has been administered 24 times by EMTs, law enforcement officers, and registered community opioid overdose prevention programs. So a combination of all of these programs have so far through the first quarter of 2017 administered 24 doses of naloxone, um, which a lot of people call Narcan, or is the same thing as Narcan. It's a drug overdose reversal drug. And this is the link that that I shared so that you could click on it and you could go to this story and read the whole story. Like I said, this county has had a problem in recent years. It's been an ongoing thing since crack really became a big thing, but most specifically the opiate, because of the painkillers, addiction, and synthetic drugs. Now this is becoming a very big issue in this county. Cuba County Community Services Director Ray Vazari said that there are more options now than there have ever been for people who want to seek treatment for opiate abuse. Just to name a few, we have East Hill Family Medical recently added addiction medicine to the treatment list of services that they can administer, and as well that's available by Medicaid. Our local hospital, Auburn Community Hospital, has a 10-bed inpatient program that is about to start. It's in the works. We have nonprofit organizations such as Confidential Help for Alcohol and Drugs, or CHAD, and the Unity House, also, who offer programs for people seeking treatment for addiction. program called HEAL, in conjunction with Nix Rides, offers heroin and opiate and narcotics anonymous support groups. And there's also some private doctors that treat patients with opiate addictions by prescribing Vivitrol, a prescription that can help prevent relapses after they detox from the drug. However, despite all of these programs and these things that we have out here available for people with drug addiction or heroin addictions, despite all that help, click on these links. Just to give you an overview, despite all that help, we look here, and this is for the state of New York, Cuyahoga County overall rank. In 2016, we were 11th. You see down here it says 30, that we had 30 drug overdose deaths, and we had a 13 drug overdose mortality rate. Take that out of there. Sorry, I'm a little unprepared for this. Second link brings us to the year 2017, and as you see here, overall rank in New York State, we're 12th, and the number is now 41 and 17 up. And again, bring the PowerPoint back up, and we click on the last link. And you see here, our overall rank is 15th. And again, the number is up to 43 and 18. So as you see, from the time of those graphs that I showed you, we have increased every year since then. And we've gone up in our mortality rate and our overdose drug death rates. My belief is for this intervention to work, for an intervention to promote healthy living and to help cure this problem, this issue, I believe that the social ecological theory is definitely in play. It definitely comes into play. We can see here from this theory, the constructs of this theory basically state that all things here are what we need involved to help cure our problem, our issue. As you can see here, early on, drug addiction has its hold here. Self-efficacy is a big issue. A lot of people turn to drugs when they feel incapable of doing things, incapable of handling situations, and they use it as a coping mechanism. And that goes back to self-efficacy. The same with the interpersonal relationships of an individual, the peers, the family, play a big part of role in addiction and trying to prevent addiction. Again, the same with the home. The home and family kind of go together. Neighborhood and peers kind of go together. And the practices and policies of an organization. A lot of the things that we get involved in could have things involved to help people deter from drugs. The community, again, just the societal norms of the area. Some things are acceptable in places that others it's not. Sometimes things are looked at upon and frowned upon, and other places they're not. So again, the community and the community standards plays a big role in helping to prevent drug abuse. And obviously, the hugest part is public policy, the national and local regulations and laws. I really feel like move this over here. I really feel like just to have an effective intervention, we have to look at each one of these 5 constructs, and we have to address situations within those constructs. I believe that with child early active involvement, I believe that programs need to be developed for troubled youth and teens to give them something to turn to other than streets and to keep them out of the streets. There's no local boys and girls clubs here, no rec centers, and etc. There's nothing like that, anything for anybody to do. I believe that we have to have an increased awareness. There needs to be more general education for the general public as to into addiction and what's going on. I believe that awareness is key. Again, I believe that more programming and education is necessary. There has to be something more available in terms of the few programs that we do have here available. With the sharp increases in these overdoses, it's obvious that the drugs are on the rise, and just a couple of places to turn to is not going to be enough. Um, excuse me. I believe that there definitely should be stiffer penalties. Yes, addiction is a disease, and as such, it needs to be helped. Um, but the crimes and other things that are happening because of the drug addiction is running rampant through the streets, and obviously, with the amount of overdose deaths going up, people are living a lot more dangerously. Things need to change. And I believe that there has to be some alternative remedies and cures um, other than the drugs that are being given out because those are in turn just as addictive, if not more addictive, than the drug that they're being used to fight them. And that's it. I know I would have had more slides, but I believe that this is the basis of a good base start for what could be a good health promotion intervention to deal with drug addiction.